So, this lecture is going to combine the very end of the skeletal physiology notes with the diseases and disorders and injuries notes. Um, there's like 2 slides of phys, so I figured that would make sense. So, we talked about bone growth, right? How kids, like bones start out as cartilage, and then the bony structures are built around them as they're developing in utero, and then as kids grow, they have an epiphyseal plate made of cartilage that can grow and then ossify, and that's how long bones grow. Bones also get remodeled throughout a person's life, or if a bone break occurs, which we'll talk about in a minute. So we all have bone cells. And the generic term, as you see, is osteocytes. Osteo is bone, cyte is the word for cell. So that's sort of a collective term. Catch-all for bone cells. But then there are 2 specific types of bone cells that I want to mention. Those are osteoblasts and osteoclasts. So osteoblasts are bone forming cells. See, blasts build. So they're bone builders. So if there was a fracture, osteoblasts would come in and build up new bone cells. If you do a lot of, like, let's say, suddenly start running, then osteoblasts might come and do some remodeling to help strengthen your bones. Osteoclasts are bone destroyers. So we remember that clasts crush, or I used to remember it as class kill and blast build. Whatever works. The anatomy is full of like silly little word things that help you remember, so they're not actually silly at all. So class, crush, and they help break down bone. And so bone remodeling, so if you do like start exercising in a different way, or if there's an injury, a bone injury, osteoclasts will come in, break down and release calcium from the matrix, and then the osteoblasts will take the minerals and things that are released and use that to build up new bone or strengthen bone in a new area. Okay, so it's kind of both of those 2 building and destroying working in combination. Okay, so now injuries and diseases, and these obviously they go well together because we need bone cells to fix injuries, right? Okay, so fractures, obviously I'm going to talk about now. There are also going to be fracture related questions on the joints assessment because there's going to be like some x-rays and things for you to look at. So it makes more sense to put it there to me. Plus it'll give you a little bit longer to like sit with the information. But there will be some sort of general generic fracture questions on the phys quiz on Monday. So anyway, a bone fracture, it's just another word for a break, right? They can be simple, so ones that stay in the skin are closed or simple. If the bone breaks and then like punches through the skin, then that is called either an open fracture or a compound fracture. I will warn you, there are some images of these types of things in this slideshow. I will warn you in advance. This is always the most challenging one for me. Bone fractures are treated by what's called reduction. So, reduction is a realignment of the bone. When we talk about dislocations, we use similar terminology. So, a dislocation is also reduced back into place. And then, in the case of a fracture, immobilization as well. You hold the bone in place so that the osteoblasts and the osteoclasts can come in and get rid of the old bone and then rebuild the new bone. There are a few different types of fractures. Many fractures are like a combination of types as well. So we have the open versus closed, and then these types as well. So first, we have a comminuted fracture when there are bone fragments. So this is more common in older people where their bones are brittle. There's less collagen, so they can kind of get broken up more easily. A compression fracture is a crushing, so it's even more sort of crushed than a comminuted fracture where you have lots of fragments. So again, common in osteoporotic bones. A depressed fracture is where the bone gets pushed inwards. So a depressed skull fracture would be one in which the skull is like indented. An impacted fracture is where the bone ends like get jammed together. So that's common if a person's falling and they put out their arms, right? That force of hitting the ground can cause a bone to break, but then jam the ends together. A spiral fracture is what you see in the picture. So that's when there's twisting forces applied to a bone. So if you are my little brother and you like slip in a puddle, you sort of slip and twist on the arm that you cut yourself with. A spiral fracture can be the result because it kind of goes like around the bone. It's a very distinctive looking fracture. And then the last one is a green stick fracture, which you can see right there. And that's when the bone break is incomplete. So if you picture a stick, like a fresh green stick, and breaking it, it's not just going to snap in half, but some of it will break and some of it might stay together. So these are common in children when there's a lot more collagen, but maybe less of the mineral hardness of bone. So, fractures. When a bone fracture repairs, it follows these 4 steps, and obviously these are a little bit simplified, but the first thing that happens is that you get a hematoma, which is also in the skin, it's like a bruise, right? But here we're talking about around a bone. So it's a blood-filled swelling forming around the broken area. Then there is splinting by fibrocartilage. So remember that's cartilage with lots and lots and lots of fibers in the matrix, what's in your vertebral disc. And that forms like a callus. So it's not totally strong yet, but it is being held together in place. So you really want, if a bone is broken, it really needs to be reduced, put back in place relatively quickly so that this cartilage callus forms with the bone in the right spot. Sometimes, especially like in the olden days, bones would break and they wouldn't get set properly, reduced properly, and so they would heal, but they wouldn't heal exactly in the right spot. So after the fibrocartilage matrix is in place, then very similarly to bone growth, a bony callus will form in the area where the fibrocartilage callus was. So rebuilding that bone. So that's the osteoblasts building up the bone. And then the bony callus, so the callus is sort of like a patch. It's not very refined. So then remodeling occurs to form a permanent patch and to make the bone the right shape and all of that to make it nice. So here is a picture of those steps. So you have the hematoma forming, so some swelling, a lot of blood flow, bringing nutrients, minerals, fibers, but also kind of holding it in place. Then the fibrocartilage starts to come and really, again, hold it in place, connect, the two broken ends. Bone, that trabeculae, that spongy bone that we saw kind of at the ends of the long bones, starts to form. You get the rougher bony callus there, so see that it's not like super neat. But then the bone gets remodeled and you get a healed fracture. Okay, so next are some images, x-ray images and pictures in some cases of some fractures. So yeah, just be warned. Feel free if you need to do some fast forward slide scrubbing, I guess, to get past some of these. That is understandable. So this first one, this is, hopefully you recognize, this is the pelvis, ilium, ischium, acetabulum. Here's the femur. You can see the head of the femur sitting nicely in the acetabulum. And this is a comminuted fracture. You can see those fragments there. And so this was fixed, as you can see, by some screws and a rod to help hold it all in place. And again, same thing, just a different view. Those bone fragments will be broken down by the osteoclasts. Okay, here is the humerus. You can see the scapula, and then this is the clavicle broken there. So clavicles are really tricky because really the only place that your shoulder is connected to your skeleton through a joint, not just muscles, is at that connection between your clavicle and your sternum. So this can be a really challenging break to deal with. Okay, the next picture has some actual pictures as well as some x-rays. So if you're squeamish about bones, this might be one you want to fast forward over. Okay, so here you can see the break in the ulna, the radius. It has been shoved past all the carpal bones. So again, they're using surgery to try to reduce it, get it back into place, and have it immobilized. And ultimately, you can see it's pretty amazing how they're able to fix it. Here's a picture. This is ulna radius. This is like the U of the ulna. Here's the humerus. So this individual's, that little ulnar notch broke off. So it's screwed back together. It's a baseball injury. Okay, the next slide is an example of a compound fracture. Feel free to skip over. So some of you might have seen this, and this is an injury that Kevin Orr sustained in a basketball game. Students every year always give me more examples of these types of fractures. So I covered it up in case you don't want to see, but you couldn't fast forward. So now I'm going to uncover it. So last chance, if you don't want to see this compound fracture. So that's the tibia, and that was broken, and sticking out. Blah. Okay, so that's all for fractures. Fractures for me are really challenging, like, to look at. I can deal with a lot of gross stuff. That is not one of them. So anyway, the last sort of thing I want to talk about is osteopenia and osteoporosis. Both of them occur usually in an older population as mineral density in the bones decreases. So osteopenia is sort of that initial dwindling of minerals in the bone. So bone density is decreasing, but it's not at a dangerous level yet. Osteoporosis, porosis, so the bones are porous, right? So you can see all of those porous spots. So this is when it becomes critical and people are going to experience more fractures and things like that. Here you can see this is a person aging with osteoporosis, so the bones are getting less strong, and you can see curvature of the spine, and then really severely here, spine curvature, because the spine isn't strong enough to stay straight. So the ribs are going to kind of impact the iliac crest, and it kind of shoves everything down and forward. So osteoporosis, often it's seen, as I said, in older people, but it can also be experienced by younger people if they aren't really getting enough nutrients. It's much less common. It's much more common in older people. So as you age, there's a decrease in hormone levels just naturally. So those are kind of one cause of osteoporosis. Lack of physical activity, so that weight-bearing activity that we do, walking, running, lifting things, all of that helps to put stresses on our bones, good stresses, and helps to keep the bones strong. Your body sends the minerals where they're needed. So if your bones need to be strong because you're running, then your body's going to send the minerals there. Lack of calcium and vitamin D, especially when you are younger, like your guys' age. You want to build up good stores of those building blocks so that when you are older and your body's less able to incorporate them, you have a store to rely on. Smoking and alcohol use can both inhibit bone density as well as like cause myriad other problems. And then medications like chemotherapy has um, tons of horrible side effects, including um, potentially causing osteoporosis. So, to prevent osteoporosis when you are young, right now, make sure you're getting enough calcium. Make sure you're staying active, building up those strong bones now so that you have them later. And then eating a healthy diet that's good for your bones. Soda can really leach minerals from bone. You might remember talking about that in biology as well. Um, so make good choices now, and your skeleton will serve you well for a long, long time. Okay, so this just kind of looks at nutrition and bone growth. So you don't need to know all of these specifics, um, but I do just kind of want you to look at this to see the importance of vitamin D, which we've talked about, um, and sort of how it relates to bone growth. So take a second, just read through this. The key thing is that healthy bone growth, maintenance of the skeleton requires not only calcium and phosphate intake, but also calcitriol, which is made um, with the help of vitamin D. So, having good levels of vitamin D is also helpful to bone growth. A lot of times you see milk that's got vitamin D fortification as well to help make sure that you're getting the calcium and vitamin D together. All right, all right. Okay, last one. It's funny. This isn't my kid level joke. They would enjoy that a lot. Um, so last things in your book, there are a few more um, like diseases and disorders in section 4.5. So make sure you look at that, like the female athlete triad. Make sure you take a look at that. Um, remember, there won't be a ton of fracture information on the quiz. Much of that will come later on the assessment. So, anyway, thank you. Bye.